Hi, everyone. I'm Jorge Castillo. I was actually one of the co-chairs for the 10th workshop that happened in New York City. And, it's always an amazing experience to participate in these workshops. What I recall was just how interesting and definitively varied, the scientific sessions were, all the way from the basic laboratory understanding, fundamental understanding of Waldenstroms, all the way into the current, treatment options, very well into the future in terms of clinical trials. There were 3 days of amazing experience and collaborations and learning process for everybody. I do recall the keynote speakers. I recall the conversation that we had about the pathophysiology of IgM-mediated neuropathy. I recall also that we talked about the genomic heterogeneity and the clonal evolution that we see in plasma cell dyscrasias, as we can use that to understand the biology of Waldenstroms. We talked about what is the actual standard of care is for patients with treatment-naive Waldenstrom's macroglobulinemia in the context of seeing BTK inhibitors as well as chemotherapy agents coming up for these treatments. We discussed about the ibrutinib resistance mechanisms, as BTK inhibitors became one of the treatment options we have for patients with Waldenstrom's. And then we focus on what new targets we can use to actually try to make our treatments more effective and hopefully less toxic too. And in addition to the keynote lectures, we actually had a series of consensus panels that were created. In that specific sense, we developed consensus panels for the diagnostic workup of patients with Waldenstrom's, and then the treatment options that we had for patients with Waldenstrom's, and what the priority should be placed into for clinical trials in the future. So with all that, I mean, I'm really looking forward to this new, iteration of the workshop.
Hi, I'm Palomba, and I was one of the co-hosts of the 10th workshop for Waldenstrom macroglobulinemia, which was held in New York in October 2018. My co-hosts were Jorge Castillo and Rick Furman. On a personal level, being an immigrant and an adoptive New Yorker, there were 2 very memorable moments, and I must say there were also very emotional moments, which were the opening ceremony at the Ellis Island and the closing ceremony at the United Nations. In Ellis Island, we presented the Robert Kyle Award to Giampaolo Merlini. And when I was a medical student and a hematology fellow at the University of Pavia in Italy, Giampaolo was one of the attendings who truly inspired me to become a researcher. He was fresh from his experience as a postdoctoral fellow in Jan Waldenstrom's lab in Sweden, and was establishing himself as a world leader in WM and multiple myeloma. For me, being able to be one of the presenters of the Kyle Award to Giampaolo in my adoptive city was really coming full circle. Then we had the closing dinner at the UN, which was also an unforgettable night. We were a bunch of international researchers meeting basically in the same place where the world leaders seek to achieve universal peace. So that was also extremely emotional. The WM workshops, generally speaking, have been so important from so many angles, from bringing to the table scientists, researchers, clinicians, patient advocates, to share their knowledge and their needs, and to establish guidelines that create uniformity in the way we approach WM. But also, it really brought together a bunch of wonderful human beings and created long-lasting friendships that will continue beyond what our daily work is in trying to establish treatment for this disease.